we democratize our understanding of medicine more and more via media. So, would you like to begin with your own understanding and thoughts on this subject about what media can do?
I'm a cancer specialist and a radiation oncologist and heading an institution currently. I agree to participate in this panel discussion with simple aim that I personally feel that media is really a backbone for disseminating the knowledge, not only for cancer for people but also health in general. And I think it is well evident from the entire let's say gamut of media which is available today. I'm sure you'll agree that every nook and corner, every individual, even in a village, has a smartphone. Similar success stories, traditional media, television is available anywhere and everywhere in the country. I'm talking only for India now, in the country and village level.
So it's great to hear the confirmation from you too. But just moving on, my question is in media, the thing is in media, we always have this conversation about the authenticity of the source.
Thank you so much. I agree a lot with what the doctor was also saying. Coming from a public health perspective, so I'm also trained as a clinician, but I'm also classically trained as a public health scientist. And public health, the backbone of a lot of public health, is actually through communication and campaigns. So if you've grown up in India, you'll remember polio campaign, leprosy campaign against tobacco, all of which have made an extraordinary impact on the outcomes for public health. And they actually evaluated, they did a cross-sectional study of
When you look at India as a whole, the nation as a whole, what kind of feedback do you get on your studies and what inspires the next study and the next research to put out to public, especially the public, in connection with public?
Thank you, Deepu, and thank you, AMTZ, for organizing this wonderful panel discussion on World Health Innovation Forum. I think, like rightly put by my panelists, that yes, the media is the powerful tool to reach to the people. Right? There is no denying that, and it is the only source through which we can communicate whatever is happening at the government level, or at a private level, or at a researcher level, at whatever level, to the common masses, even to the poorest and uneducated person of the society. That is only through this media, this mechanism, that we reach to everyone, even to those who can read, listen, or whatever.
You know, we struggle to get funding to make that movie. Can you imagine? We struggle to get funding to make that movie. And today, if you see advertisements, they earn money which is unaccountable. But we try to make a story which can help people quit tobacco. We struggle to get funding, official funding for that making that movie. That is the state of affairs. Media for betterment, media for
medicine. Because you see, by writing, there have been a lot of cases earlier on where you write about some medicine and people take it randomly and then they get all kinds of effects. So, especially what I'm trying to say is the laws have already started coming in with regard to certain specific ways of talking about, say, medicine or treatments, or we are under a proper legal system. But even the rest of it, like what you have said, see, this is really a double-edged sword. It's not like in India you don't have tragic deaths of newborn babies due to carelessness, or something being set on fire, or we still have all that happening in the country. So you do need some arm to talk about it and put the human body to everybody, right from the administrator to down. So because you do need to, I mean, medicine is in that sense about life. But everything you are saying is, I take it very well. I know exactly what you're saying about handling matter carefully, thinking of the impact of whatever it is that you are writing or speaking on television or even putting online. I think for the case for this discussion, we can actually put aside the platform, whatever platform is going on. It has to be. What I have seen personally is also that Indian health tremendously removing stigma. Like cancer was a subject that we talked about. Even if you had a cancer patient, nobody's ever discussed it outside. And now with celebrities and who you also said, I mean, they are a double-edged sword, frankly. When they, came out and spoke about it, it is so much easier to talk about cancer, go out and talk about advice for treatment and things. So social stigma is a big part of healthcare. I'm sure all of you agree. So we come to you, the B2B of media, where they're taking all the topics of media, sharing it with the pool of doctors and hospitals. So
thank you AMTZ and Remy for giving me opportunity to speak. So as we are B2B media, so we bring the knowledge from doctors, from industry to the people. Not the last common people, but hospitals and doctors who are sitting in rural area, tier 2, tier 3 cities. They need also knowledge. So like doctor sitting in Dr. Umesh, associated with Tata Hospital, they are doing a lot of research, a lot of wonders. It should be reached to other doctors who is sitting in Bihar and treating the cancer patients. How this story we are bringing in our Medicate magazine. So we are not experts. So I was discussing with madam that social media and other medium is impacting the patient's life. And they are seeing a lot of messages in WhatsApp, YouTube and everywhere, and they are doing same. But I warn them, they should not do anything without prior advice of doctor. Even I am a doctor. We were interacting with a doctor for last 15 years, but I am not taking a paracetamol without any prior confirmation from doctor. Because we don't know the criteria of a prescribing patient. Doctor is keeping in mind everything. The weight of the patient, the age limit, the situation. So, social media is good for mental health, I can say. In some case, we should rely upon these things where there will be no side effect on our body. Like well-being things, yoga, we can do. But for serious illness, we must confirm with doctor. We should take first opinion, second opinion. Never rely upon any media, I will say. Because the Times of India or Medgate or whatever the medium is available, so they are also taking from Google. My journalist is here, I will say that research on that. He is not talking to the doctor. He is just Googling and taking the data. Sir, this is the data. And same data is going to publish. Like data she came with, is not talking with the people. Like you said, the data is something different. The actual mortality rate is different. Yeah. So, if you will see the people is writing, so this is research conducted in 2023 and this is 2024 or 20. So this is very old data and that time technology was different. So if you will correlate that same this thing, then it will be not will be true, because in this era the technology is high. Here in AMTZ I am saying in 360 days one building is going to build. So they are doing miracle. In health science also we are doing on daily basis some 80 years engineers here, some transplant done, some very interesting things is doing. But we have to see the different digital media. So you can rely upon Medgate today. and this medium is 100% authentic. We are not taking anything. Here Mr. Palwanjani is sitting. So if we are doing any story, we will first go to his factory, see the thing and verify, then publish. If we will talk to doctor, same thing, we will cross check and ask the patient. The patient is, what is the feedback from patient? So same way, here one of my colleagues was there, he is also doing something good. So we will publish the data surely, not for advertisement, not for publicity, but for the sake of community, for the sake of medical fraternity. As a B2B media, we want to give the spirit of knowledge. So thank you so much, ma'am. You have given me the opportunity.
So in your own practices and in your space of public health and in your work that how have you seen things change with conversation? Because in the end it's the patient. The last mile for us is always the patient in the space. So how have conversations changed? See, it's no longer a question of I have taken this medicine because the doctor gave it to me. That conversation is over. There is a lot more interaction, and today doctors tell patients, even in specialty hospitals, these are the options open for you, 1, 2, and 3. You decide and tell us, sitting with us, discussing what is your treatment pathway. And I have never seen that before. This is like recent medicine, just talking about India. So this whole world of patients and medicine and doctors and information. If you could, Dr. Umesh, we'll start with you.
I can tell you the recent story. So in last 2 days, I counseled 2 breast cancer patients. Day before, this woman was a young lady. She is a teacher in school. And I spent 2 hours talking to her. That was only her first day. And I spent 2 hours, which is unusual because every patient we meet, I think not more than half an hour, 45 minutes. We troubleshoot all the issues. The reason I spent 2 hours with this lady was, first of all, she was very motivated, very educated.
Yes, absolutely. I remember a hilarious story when I had one of my friends who's a senior, she's also a senior in science, and when this is when Google started, and she was a homeopath. So she would look at, there are conditions and then there's the treatment, and she said every single medicine, whatever condition was there, I used to feel I have this problem also. I have that problem also. She said, I literally feel I have every single problem in the world. All the symptoms are there. I'm heading toward cancer and a heart attack and dialysis and everything under the sun. So this, you just need wild imagination, and you can. So why? This is something we are experiencing on a day-to-day basis. So
I can replace doctor.
So the human component is simply the most precious.
Please, just to add to what Dr. Umesh was saying, I think we live in an age of information overload. We did not have this much of information when we were growing up. And our children, and maybe the children after them, are going to live in a virtual world with tremendous amounts of information, often produced at the snap of a finger. So when you Google or use AI or get on a YouTube video, or even YouTube is now outdated, and Insta Reel is more the attention span of the next generation, you are accessing information in different modes, different formats. And therefore, I think what my takeaway from what you said was also to contextualize it. Because sometimes information standing alone without context can only scare you. So there's a lot of scaremongering that's happening with all this information out there and nobody to put it in place for you. And for that, you need humans. You need doctors, you need professionals to contextualize that information. Otherwise, you're going to be swimming in a sea of probabilities for which there's no end. But the upside of great communication and this ability.
Very few people understand in India as well as ICMR does in terms of its, the bandwidth, the depth, do you see ICMR playing a greater role?
Yeah, I think from ICMR, one we have the website, most of the information we are putting it as a kind of the reports, the annual reports, but we are very careful in putting up the reports on the media because the whole thing is so whatever is the positive outcome or whatever the outcome of the research, so most of the task force studies outcomes are published on the ICMR web page.
Like nobody has the power to reject an ad basis what it is because nobody can authenticate every single ad. You can do that. Nobody else. So I agree with you.
Yeah.
The advertising council also has.
The common mass they start using those therapies.
Yes, immediately.
There is a lot of side effect of these therapies, right? So.
Yes, but I would like to say that in general, and I'm speaking for most of the senior editors I know, I do take both the positive and I'm very aware of what can go wrong as an editor, very aware. But I've just been told that we have to wrap it. So would you like to just give us the last?
Yeah, thank you panelists for giving your insights because we are on another side. I generally don't answer the questions. I generally question the asking nature I have. So I'm not comfortable in talking much. So I would urge you doctors to please vocal and do write what you are doing good work so that we can publish and our readers can know about that. And we also write disclaimer that you should have to contact doctor in any case. Don't read self-medication.
So well put, and we had done this entire exercise for several years, and we've never got that kind of positive thumping feedback from people as much as we got out of that project. So yes, that is one thing we have to perennially be conscious of, that we take it. And so thank you. It's been a great panel. We have limited time, but all points well taken. Thank you so much.